Now coming to next drug, it is febuxostat. The starting dose is 40 milligram per day and the maximum dose is 80 milligram per day. Most important problem of giving febuxostat is that it is very expensive. Now coming to next, uricase. It mainly includes two prototypes. One is Ras uricase, a recombinant form. It is given in case of tumor lysis syndrome also. The other one is IV pegloticase, and this pegloticase is given when the urate lowering therapy is refractory to other drugs, and the dosage is usually given IV every 2 weeks. Please remember, this drug has a high risk for anaphylaxis and you should discontinue this IV pegloticase if uric acid level fails to reach target or it rises above 6 on 2 consecutive terms. Now coming to uricosuric drugs. There are certain factors that you have to look for before giving uricosuric drugs. One is the GFR is less than 50 ml per minute, then you cannot give uricosuric drugs. And also if the uric acid level is more than or equal to 800 milligram in 24 hours, again you cannot give uricosuric drugs. So please remember, in these two conditions you cannot give uricosuric drugs. And also you have to give high fluid to these patients while giving uricosuric drugs, and also may have to alkalinize the urine before giving uricosuric drugs. Okay, and this includes mainly two drugs. One is probenecid, here the starting dose is 500 milligram OD and you can raise it 500 milligram per week till either uric acid level becomes normal or the uric acid level becomes 800 milligram in 24 hours. Okay, the maximum dose of probenecid is 3000 milligram per deciliter, and while giving probenecid you have to advise the patient to avoid salicylates. Okay, you see the salicylates repeat several times. So in the patients having like inclusion close, they can precipitate, they can also affect certain drugs that can help in the treatment. So those patients having gout, you aspirin is a big no. Then the probenecid also decrease excretion of certain drugs like penicillin, indomethacin and sulfonylureas. Another example for uricosuric drug is sulfenpyrazole. sulfin pyrazole. The dosage is 500 milligram BD, and you can raise it by 100 milligram per week, and the maximum dose is 800 milligram per day. So that's about the treatment of gout. Now coming to treatment of pseudo gout. In pseudo gout also the guidelines are same. We will give NSAIDs. If the patient is not responding, we will try corticosteroids, and if the patient is having dramatic relief, we will do first intra-articular aspiration followed by intra-articular injection. And in those who are refractory to NSAIDs and corticosteroids, we will also give colchicine. And please remember the most important thing, we have to treat the secondary or underlying diseases also. In case of pseudogout, it includes several, but most important are hyperparathyroidism, hypothyroidism, and hemochromatosis. Are you missing something when compared to gout? Yes. The urate lowering therapy has no role in pseudo gout, because here the deposition is not due to urate but due to calcium pyrophosphate dihydrate. And what about the treatment of appetite? I told you in the beginning, the treatment of appetite is same that of pseudo gout.